Is a spinal tap really needed for misdiagnosis? When doctors suspect multiple sclerosis, they want to find the most accurate way to confirm it. But do they always need to perform a spinal tap? Not necessarily. Advances in medical imaging have changed how we diagnose this condition. A spinal tap, also called a lumbar puncture, involves inserting a needle into the lower back to collect cerebrospinal fluid. This fluid can show signs of immune activity linked to multiple sclerosis, like elevated white blood cells, increased protein levels, or specific antibodies called oligoclonal bands. About 90% of people with MS have these bands, so they can be helpful clues. However, a spinal tap is not always essential. Many neurologists can diagnose MS based on a detailed review of symptoms combined with magnetic resonance imaging scans of the brain and spinal cord. Modern MRI technology can identify characteristic lesions, especially when they show the central vein sign, which is a small vein running through the lesion. If an MRI reveals 6 or more lesions with this sign, it can strongly support a misdiagnosis without needing a spinal tap. This approach is faster, less invasive, and more comfortable for patients. It also allows for earlier diagnosis, which is crucial because starting treatment early can help manage symptoms and slow disease progression. Recent research shows that relying on MRI findings alone can be just as accurate as including a spinal tap in many cases. That said, a spinal tap still has a role. If MRI results are inconclusive, or if doctors need to rule out other conditions that mimic MS, such as infections or other neurological diseases, a spinal tap can provide valuable additional information. It can also help confirm the diagnosis when clinical signs are unclear. In summary, a spinal tap is not always necessary to diagnose multiple sclerosis. Advances in MRI imaging have made it possible to diagnose many cases more quickly and with less discomfort. The decision to perform a spinal tap depends on individual circumstances and should be made by an experienced neurologist. Early and accurate diagnosis is key to effective management and improving quality of life for those with MS. Always consult a healthcare professional for personalized advice and diagnosis.